What if you went to an artificial intelligence, an AI tool, and asked them questions about your ears? My name is Dr. Ben Thompson, audiologist and founder of Treble Health. In this video, I'm going to ask ChatGPT 10 questions about the ears, including tinnitus, earwax, and more. Let's get started. All right, first question I'm going to ask here is, what should I do if I have tinnitus? Well, within about 10 seconds, it created a 7-point answer. So let's review those answers. Number 1, consult a healthcare professional. I agree. Number 2, identify and manage underlying causes of tinnitus, including loud noise exposure, earwax blockage, medications, stress. That's very good. Number 3, manage stress and anxiety. Okay, that's not bad. Number 4, protect your hearing. Number 5, avoid silence. Number 6, tinnitus retraining therapy. Yes. Number 7, support groups. I actually like these answers. I think ChatGPT really hit it. What should you do if you have tinnitus? So yes, get an evaluation by a healthcare professional, reach out for help, try to identify the root cause of tinnitus, and do things like manage stress, protect your hearing, avoid silence, follow tinnitus retraining therapy. That's excellent. And support groups can't hurt either. So overall, I would say question 1 passes the test here. And question number 2, why do I have tinnitus? You may hear me say tinnitus or tinnitus in this video. Both pronunciations are acceptable. Healthcare professionals like myself typically say tinnitus. All right, so here we go. ChatGPT lists these answers in response. Here are some common factors that can contribute to the development of tinnitus. According to ChatGPT, exposure to loud noises, age-related hearing loss, earwax blockage, medications, medical conditions like TMJ, cardiovascular, head or neck injuries, stress and anxiety, and other factors. Not bad. I would say it does cover the most common situations like exposure to loud noises, some hearing loss, earwax, medical issues in the ear, medication changes, stress, anxiety. So overall, I would say ChatGPT passes test number 2 as well. All right, question number 3. Are there any products that claim to help tinnitus actually a scam? The AI responds by saying, while it's important to approach products claiming to help tinnitus with caution, it would be inaccurate to categorize all such products as scams. There are legitimate products available that can provide relief and management for tinnitus symptoms. It's crucial to evaluate each product individually and consider factors such as scientific evidence, customer reviews, and expert recommendations. Oh my God, I love this AI tool. I love ChatGPT right now. It's basically saying that there are real solutions for tinnitus, and while there might be some scams, usually herbal supplements, while there might be some scams, sometimes other devices as well, we need to look at each option with a critical eye, looking for scientific evidence, customer reviews, and expert recommendations. I feel like this has been my life for the past 3 years. Creating Treble Health is building scientific evidence, reviewing existing scientific research evidence to support different treatments, obtaining customer reviews, showcasing success stories on this YouTube channel, and then providing expert recommendations myself. So I really like this. It's not giving us any specific scams or products, but I can tell you the ones that usually come up would be herbal supplements. There's just very little to no regulation on those. They can say whatever they want in the marketing. One thing that ChatGPT recommends here is to get money back guarantees. So I sort of agree with them that whatever you're trying, there should be a period where you can try it, especially if it's an expensive treatment. That's what we do at Treble Health. So, all right. That sounds good. Let's go on to question number 4. This next question is going to be a more general health ear related question. Is earwax bad? And it responds by saying, in general, earwax is not bad and serves as a protective purpose for the ears. Here are some key points to understand about earwax. The AI tool here is reviewing why earwax can actually be a good thing, which is the right answer. So earwax can help with protection against dust, debris, foreign objects in the ear. It can help with lubrication of the skin, preventing dryness or itching. It has a self-cleaning mechanism. So over time, it helps push that out of the ear canal. It's so true. And it mentions an accurate point that in most cases, the ears do not require active intervention for earwax removal. So again, ChatGPT passes the test.
This is a short interruption from today's video to announce the tinnitus quiz. If you're watching this video, there's a good chance that you or someone you know has tinnitus. We know how much tinnitus can impact your daily life, and we're here to help. Visit tinnitusquiz.com and take a 2-minute quiz to receive personalized treatment plans that have helped hundreds of people learn to manage their tinnitus. Start now at tinnitusquiz.com.
Now let's ask question number 5. Which herbal supplements are best for tinnitus? This is almost a trick question because there are very few, if any, that are appropriate for tinnitus. Very few, if any, are science-backed or research-based. So let's see what kind of answers that it comes up with, and I'll analyze them here. ChatGPT starts by saying, while there is no definitive herbal supplement that's been proven to cure or eliminate tinnitus, some herbal supplements have been explored for their potential in managing tinnitus symptoms. It's important to note that the effectiveness of these supplements vary person by person, and scientific evidence to support it is limited. Speak with a healthcare professional. All right, so more or less that's accurate. I would say this is a gentle topic because I don't want many people with tinnitus buying herbal supplements. It's how most people waste money in this world. So, all right, let's go into what they recommend. First, they say ginkgo biloba, which could have blood circulation and antioxidant properties. Some studies suggest that ginkgo biloba may provide mild relief for tinnitus, but the results have been mixed. That is accurate. That is totally spot on. The second point they say is zinc. They say some studies have explored the potential benefits of zinc supplements for tinnitus. That's interesting. I've never personally seen that or heard about that or had that been spoken about much. So I would take that with a word of caution. Definitely do not recommend going out and getting zinc for your tinnitus. And finally, ChatGPT suggests that magnesium could be beneficial. And they say magnesium is involved in nerve function and has been suggested to have a protective effect on the auditory system. Some studies have explored the potential benefits of magnesium supplements, especially for those with magnesium deficiency. However, the evidence is limited and inconsistent. Again, it's important to consult with an audiologist or a healthcare professional before considering magnesium. So overall, I think that's B- as a result of answering these questions. I think we sort of tricked it by saying which herbal supplements are the best, but it did an okay job of acknowledging, hey, there's not much science, there's not much evidence to support this, but because you're asking about it, here's what I found. So I would rate this a B-. And we have had a conversation with a physician on our YouTube channel who suggested that magnesium can be used, especially to help with sleep and regulate sleep. So there's some potential there, and we're not completely against using herbal supplements. They often have little or mild side effects. So just be careful with that and don't go out buying a lot of herbal supplements right away for your tinnitus. Question number 6, if I have tinnitus, do I also have hearing loss? And ChatGPT responds, not necessarily. Tinnitus and hearing loss can occur independently of each other, although they can also coexist in many cases. While tinnitus is commonly associated with hearing loss, it can also occur in individuals with normal hearing or with various degrees of hearing impairment. So that's very true. And we know that tinnitus is often linked, as it's saying, to damage or dysfunction in the auditory system, but not always. Not every kind of tinnitus is related to a hearing loss. So that answer from ChatGPT gets an A-. All right, for question number 7 here, I'm going to ask a challenging question that only most audiologists would be able to answer. It's more of a technical, clinical question. And the question is, I have asymmetrical mixed hearing loss with severe tinnitus. I've already tried hearing aids. What is another treatment option that I could try to hear better and reduce tinnitus? And ChatGPT answers with cochlear implants, tinnitus retraining therapy, cognitive behavioral therapy, sound therapy, medications, mindfulness techniques, and stress management. So I would say on this question, it fails. Maybe I tricked it because I said, I've already tried hearing aids. And the answer I was looking for, the answer that a good audiologist would have, is we can try something called bone-anchored hearing aids, which is also shortened to say BAHA. So when someone has a mixed hearing loss, it means part of their hearing loss is to the physical structures of the ear, and part of it's related to the nerve structures of the ear. So having a certain kind of hearing aid that bypasses the acoustic sound element and it vibrates the bones, it can really stimulate that nerve in a way that provides a lot more clarity and easier to understand speech from the device. So bone anchored hearing aids, BAHA, was the answer I was looking for, but ChatGPT failed. I would rate it an F on its response there. Question number 8, are there things that make tinnitus worse? All right, it's amazing how quickly it can come up with the answers. So it came up with 7 options. Number 1, what can make tinnitus worse? Exposure to loud noise, stress and anxiety, poor sleep, certain medications, alcohol and caffeine, earwax blockage, or nicotine. Most of those are true. Alcohol and caffeine could potentially make someone's tinnitus worse, but most often it does nothing. So don't be afraid of having moderate amounts of alcohol or caffeine. Usually it does nothing. Similarly to salt or even sugar, that's usually not going to change your tinnitus. And if it does, it's just in the short term. So the other pieces here certainly can make tinnitus worse. Loud noises, stress, poor sleep, earwax. Nicotine, I'm not so sure about. I'm not here to say that nicotine is linked to increases in tinnitus. So overall, I would rate that answer as a B-. Question number 9, I'm excited about this one. The question is, what is the best option for tinnitus treatment? Here's how ChatGPT responds. Number 1, sound therapy. Number 2, counseling and education. Number 3, medications. Number 4, tinnitus retraining therapy. Number 5, cognitive behavioral therapy. Number 6, addressing underlying health conditions. I would say this is a B+ answer, and I'm pretty happy with how this AI tool is giving some recommendations here, because all these things absolutely are what we see as helping patients. Medications, that one is why it's not an A answer. I think it's a B+ because medications are rarely used in the treatment of tinnitus. Quite frankly, sometimes they're used to help with associated conditions, insomnia, severe anxiety, things like this. But every other answer here is spot on. Sound therapy, counseling and education, tinnitus retraining therapy, cognitive behavioral therapy, addressing underlying health conditions. I mean, this is what our team at Treble Health does every single day with our patients over telehealth. So I'm really happy to see this answer. Makes me proud. And finally, question number 10, which doctor should I go to for tinnitus? And the answers are number 1, an ENT doctor, what's also called an otolaryngologist. Those are medical doctors who can prescribe medication, do surgeries, review your test results, do a physical evaluation. That is definitely one of the right answers. Answer number 2 is audiologist. I'm an audiologist. We can diagnose and treat tinnitus as well as hearing loss. So that's definitely right up there. And then number 3, it says tinnitus specialist. So some healthcare professionals that may not fit into the audiologist or ENT groups still could help individuals with tinnitus. But I would say it answered the question accurately. I asked, which doctor should I go to for tinnitus? And it said an ENT doctor or an audiologist. Usually every patient should go to both at some point. It's often the audiologist like myself and our team at Treble Health who are guiding patients through the entire journey of tinnitus. But overall, that's an acceptable answer. Well, my takeaways are that AI definitely has the future in healthcare and information. Still be cautious. Don't completely trust the answers from an AI tool in relationship to your health or your hearing or your tinnitus. But overall, I would say it was about 85% accurate in terms of the recommendations. And I like how that specific tool, it wasn't over recommending something. It didn't have this false sense of confidence. It was recommending to speak with medical professionals. It was recommending to work with audiologists. It was recommending tinnitus retraining therapy, sound therapy, counseling, one-on-one care, cognitive and behavioral tools, mindfulness, relaxation, stress reduction, really all the things that you're probably already learning here on my YouTube channel. So it's been a pleasure. My name is Ben Thompson, audiologist, founder of Treble Health. If you need help or someone you know needs help with tinnitus, please reach out to our team. Go over to treblehealth.com and we'll be glad to get you started. Thanks so much. Bye.